Hi, I'm Zoe Bell from Liverpool John Moores University. Contact centre advisors often face low pay and poor working conditions, contributing to high sickness and attrition rates. Despite contact centres being a priority setting for health promotion, there has only been one review conducted exploring health promoting interventions for contact centre employees, and these searches were only up to 2010. With the needs for an up to date review, we conducted a systematic scoping review to explore the evidence for health promoting interventions for contact centre employees. To do this, we investigated the volume, nature, and quality of the evidence, as well as exploring the reported effectiveness, acceptability, and feasibility of these interventions. This study followed the PRISMA guidelines for scoping reviews. After searches and screening were complete, data was charted and studies were critically appraised. Interventions were then mapped to the behaviour change wheel featured on the right-hand side of the screen. The behaviour change wheel is a systematic framework for designing interventions, encompassing 9 key intervention functions and 7 policy categories to promote behaviour change effectively. Specifically, we mapped interventions to the 9 intervention functions, which can be seen in the red part of the wheel, and also to the more specific behaviour change techniques. The search strategy conducted on the 21st of February 2023 located 328 published studies. After screening, we identified 26 peer-reviewed papers containing 28 intervention studies, which were published between 2003 and 2022. 10 of the 28 studies were randomized controlled trials, 8 were quasi-experimental trials, and 10 were pre-post studies. Most of the 28 studies were conducted in high-income countries. Only one of the interventions had a home-based component, and most of the participants were relatively young, with the highest mean age reaching 40 years, worked day shift hours, and only 2 studies focused on advisors who were disabled or had a long-term health condition. We found that interventions targeted health behaviours, such as targeting smoking, sedentary behaviour, and physical activity, physical health, such as sick building syndrome, for example, headaches, musculoskeletal pain, vocal health, and visual health. And finally, mental health, so job control and job satisfaction, general well-being, and stress. The most used intervention function was environmental restructuring, which mainly added objects to the environment, for example, sit-stand desks. The second most used intervention functions were training components, for example, training advisors on how to use adaptive desk equipment. We also found that no intervention used coercion, so for example, this could be creating social disapproval of smoking, and no interventions use restriction, such as banning smoking. Only 5 out of 28 studies reported on acceptability and feasibility. From these, all interventions were acceptable, and only one intervention was not delivered successfully. This was a stand-capable hot desk. Only 4 out of 28 studies failed to report effective results for their primary intended outcome. These studies included an ergonomic checklist to improve musculoskeletal health, a screen filter to reduce visual fatigue, and 2 interventions putting plants into the office space to improve well-being. There is a lack of evidence on health promoting interventions for contact centre advisors. More high quality research should be conducted to explore the effectiveness of interventions, for example, using a clustered RCT design, as well as exploring the acceptability and feasibility. Most interventions were conducted in high-income countries, despite middle-income countries such as the Philippines and India holding the second and third largest proportion of contact centres. Contact centre advisors underrepresented in the current evidence include remote workers, older adults, night workers, and disabled workers. This may be problematic with the recent surge in hybrid working, meaning that more intervention research is needed for remote and hybrid working conditions. This gap in the research is also problematic as we know that poor working conditions are more likely to have a negative effect on night shift, disabled, and older advisors. Overall, this scoping review has identified and synthesised health intervention research for contact centre employees that can inform future policy and practice in this occupational setting. If you have any questions or would like to find out more about the research, please contact the email address below. Or if you would like to read the academic paper, there is a QR code to scan.